pieces out and start getting ready to stuff the bird and
Sounds good. Hey,
I hear a lot about, fires during prepping for Thanksgiving dinner, especially people like frying turkeys and deep frying turkeys and things like that. Do you have any advice for people who are trying to do that?
So deep frying is a big hot topic, and I haven't seen it as much recently in the last year or so, but for a couple years that was the best way to make your Thanksgiving turkey was to fry it. And so a lot of people they don't have the equipment that you need to do that safely at home. Um, so I would see weird setups where they're setting up in their garage or their driveway or even trying it on the stove with a big pot of oil, which just frightens me because if anyone has fried stuff, you know that if there's any moisture or any water, it's gonna spit that grease back up and it could ignite. And that's usually what happens is they dunk a turkey that's still wet into a giant pot of boiling oil and they get an explosion or fire that way.
Hmm.
So don't do that.
you know, I'm so happy that you sharing that information because as Hispanic, we like the fried foods all the time. So, one of the things that I was doing that is frying. It might not be turkey, but I might be chicken or like that. But I hear your tips and ideas. So they are important. Yes, and other times everything that you said, I do. So
Yeah.
I'm gonna do some changes now.
One person reached. Yes.
Yes. So
One
you are
less
going
fire.
one less fire. Yes. Thank you, April. Oh my God.
The fire marshal might actually have some really good tips on their website. I have not checked, so I don't know, but I think they would be able to give you guys some good advice if you want to do some frying.
Yeah, thank you.
Do you have some advice for leftovers? Because that's a big topic too, right after the
That
holiday.
is, because you make so much food and your eyes are bigger than your stomach and you have the giant pile of mashed potatoes and half a turkey and green bean casserole and sweet potatoes and all of that good stuff is left over and it makes great leftover meals, but you want to do that as safely as you can. And so with leftovers, you want to cool them down. You don't want to sit them out on the counter for 2 days and then put them in the fridge. So you want to cool those things down as quickly as you can and put them in the fridge. And I'm very neurotic, so I label things so I know exactly what it is. And you can freeze them, and that helps if you're freezing stuff to put labels. But you don't want to keep it in the fridge longer than maybe 3 or 4 days. So you want to heat that stuff up in the next, couple days following Thanksgiving.
Good tips.
Yeah, right. And one thing I forgot is when you reheat your leftovers, you want to do it all the way. You want to make those leftovers up to 165 degrees Fahrenheit, all the way through, because food that goes up in temperature and then down in temperature and then back up in temperature, that's the best opportunity for any bacteria to grow at that time and temperature change. So you want to get it all the way up to 165. That'll kill any of the E. coli or salmonella.
I think these are great tips because obviously we want everyone to enjoy their holidays, but even enjoy the time after as well. We don't want anyone ending up at the hospital or being sick during the holidays. So hopefully everyone got something that they can use from your tips. So I hope everyone enjoyed that. It's also like as the weather gets colder, and I know we've already had like one case of division of the flu. Lewis, what things can people do to prevent getting sick? Because again, we want people to enjoy their holidays. We don't want people out sick. We don't want people at the hospitals during the holidays. So what good things can people do? I know washing your hands.
Washing your hands, but probably the major one for me as public health worker would be vaccination is very important. We recommend CDC actually recommends that people get vaccinated at least once a year for the flu, for the influenza. In a lot of times people ask why does it have to be every year? We explain people that the influenza virus changes every year. So uh, people that uh, do the vaccines, they have to check in the strains that supposedly are going to be in the area that you live. So that's why every year is recommended because the variations in viruses change so often, and the vaccination is the number one. It will be the key to avoid getting the flu. And also, washing your hands is very important. And it's a simple thing to do, but it's very important because the influenza virus, if a person is going to get influenza, if a person coughs, and it's going to
Spray.
spray droplets, they call it. If the next person next to is going to inhale that, that's a way of spreading the influenza. That's why important wash your hands as well.
And how long should you wash your hands for? Because I heard you should sing that happy birthday song twice.
Yeah,
Two
two
times.
That's what we tell people in the restaurant when they're doing their hand washing. It's one or two happy birthdays.
Happy birthday! I always do one. See, I learned something. I wanna do
Another
two now.
another important thing that people should do if they get sick is stay home, away from other people, so that we don't get other people infected with the flu. So that's also an important thing to remember. You're listening to the Public Health Hour, and this is Lisa Vasquez, Substance Misuse Prevention Coordinator. I'm here today with April Torhan from our Environmental Health Department and Louis Forrest, who's our outreach worker. April, can you tell us a little bit about what environmental health does? Because I feel like it took me a while of being at the health department to understand what you guys did. Can you talk a little bit about
Well,
what you do?
the bulk of what my department does deals with food protection. So we are the health inspectors. So we go into the restaurants and we do routine health inspections. And depending on what kind of restaurant you are, would tell us how many times we need to go do a routine inspection. We also do plan reviews for new and incoming restaurants, and then we also do other inspections for childcare, foster homes, septic systems, um, some housing inspections as well. So we do cover a lot, but the majority of our life revolves around the food service world.
And why is it so important to have like food inspections?
Well, we'd like to think that everyone does the right thing all the time, but that's just not the case. And so sometimes it's a matter of people just not knowing what the right thing to do is as far as, how hot do I have to heat up this leftovers? How cold should the refrigerator be? So it's very important that we go in and a part of our job is education. So we're there to help them understand what is safe. So, certain bacteria don't live past a certain temperature. So we can convey that information to them and so that they can understand that, certain foods have certain bacteria that can become dangerous. But every year, probably 1 in 6 people get some kind of foodborne illness. So us going in and helping to stop some certain behaviors or find about, certain pieces of equipment that aren't working in the restaurants or, rodents or other issues that may be causing illness for the customers and the employees.
I think sometimes we don't we trust in our appliances that they're working all the time, and it's hard to know if it's off by a couple of degrees, which might not seem like a big deal to someone, but it might be a big deal to that bacteria that's
Yes.
growing in there.
So, there's
yeah.
certain bacteria that are very sensitive, but if they're in their happy zone with the temperature, they're gonna keep growing. So we want to check that temperature daily. So in the restaurant world, we tell people the refrigerator needs to be 41 degrees or lower.
That's
I
good to know.
Yeah, I wanted to add a little bit. I'm lucky enough to be sharing some time with the environmental department, and I have learned so many things from that department. Going out to do restaurant inspections with April and assisting her in a lot of the restaurant industries has been taking uh, for Spanish-speaking people. So my help with them a lot of times is as simple as interpretation. And I'm so glad that this department exists because and they control the food industry because if we don't in a way um, make sure that they comply with all the requirements, I know that diseases will be out there more. And that's why this department is very important because, someone has to be telling the people that they have to do certain things a certain way, they have to meet temperatures, the importance of washing hands, glove use, and all of that. Otherwise, these things may not happen. So and I'm lucky enough to work with them and I share that information with my Spanish speaking people.
And
Take
we're
it,
so
Rico.
glad to have you help us, Luis. It is a great asset to have you working with
Thank you, April.
us. So, Louis,
Yes.
what does an outreach worker do
Besides going with environmental health and sometimes interpreting, like
Oh.
what does your job look like?
All right. I love my position because it takes me to a lot of different environments. Let's say, like I said, a lot of times I go with the environmental department and go into the food industry, which means restaurants and anybody that works with food. So my day goes from restaurants. A lot of times I go to hospitals or big stores to check how they manage the food and all of that. But if I'm working with, let's say, the nurses, each nurse has a program that has to manage in a way. So my role is very similar, but it might vary from program to program. Let's say, just to give you an example, if I'm going to be working with the tuberculosis program, which is Teresea Calope that managed that program, my role would be as simple as if a person is identified to have a tuberculosis disease, this person is put up into a regimen or treatment which can last between 6 to 9 months. So my role with that program would be as simple as making sure that they take their medication daily for that period of time. And so that requires me to be going to do home visits through the whole 6 months or the time that it requires. And for other programs, my role is similar, but it varies. Let's say if I'm going to be in the STD program, I can do the STD counseling and testing for HIV, hepatitis C, and during that time, my counseling would be as simple as just trying to identify risk behaviors that a lot of times people know and trying to address them and give them ideas on how to reduce the risk. So it's very similar, but little differences between program to program. Like the target populations for program to program might vary. Let's say if I'm going to be working with the lead program, my target population would be children under 6. If I'm going to be working with the other programs, my target population varies from program to program. And so it's very similar, but I do all of those things.
It sounds, both of your jobs sound really cool in the fact that it doesn't seem like every day is the same. It's going to vary from day to day, depending on where you go. You're going to interact with different people in the community.
Yes.
I think that's pretty cool.
It is very cool.
April, how long have you been working at the Division of Public Health?
I started working for the department in September of 2007.
Wow. It's been a little
It's
bit.
been a few years.
How
Wow.
about you, Louis? How long have you been with the division?
I think I'm a little
A little bit older.
older than April, if I'm not confused. I think I remember it was April 1st.
Ooh.
Yeah, April.
April
See, we got
Fool's Day.
something in common. Yes, April, and the year I think it was 2006, if I'm not wrong. Yeah, so I'm a little older than April, but since then I've been doing this and I really like it. One of the things that I want to emphasize on is that definitely my days are very different from one day to another. I work with a lot of professional people that are probably a lot of the knowledge and experiences that I have is working with them and learning from them and also going to trainings that the division sent me to and enjoy my days because a lot of the time it requires me to be on the streets working with certain programs and assisting people, we have a population here also that needs the same services, and it's a little harder to be reached, and that's where I come in play, to working on the streets, talking to people.
So we're gonna do a little like behind the mic segment. So April, tell us who is April behind the mic?
Oh my gosh, I was so unprepared for this. I don't know, Lisa. What kind of information were you thinking of?
Like who's April? What does she like to do? Does she have pets? What are her hobbies? Things like that.
Okay, so I'm not a New Englander natively. I grew up in the Southwest in New Mexico and then moved to Colorado for a number of years. And then I moved here right before I got the job with the division. So I've only been in New England for 12-ish years. So some of this is still new to me, the culture here and the names of places and what to do and where to go. But I do running, and I have a cat who likes to play with my socks and drink my coffee for me. So yeah, but I do enjoy going out and hiking and walking and traveling.
I
like
know
to travel
traveling. I was
every
going to say
year.
you forgetting traveling because I know you travel quite a lot.
I do travel.
What is the like farthest place you've traveled to?
Oh, I mean, I've been to Asia, I've been to Australia, I've been to Europe. I have not been to Latin America, well, South America, I should say. I've been to Mexico. And I've also not been to Africa, but Africa is definitely on the bucket list.
Oh,
Nice. Nice. So you're listening to the Public Health Hour. I'm Lisa Vasquez, Substance Misuse Prevention Coordinator at the Division of Public Health and Community Services. And I have a new guest, Teresea Calope. She's one of our nurses at Community Health, and she's going to talk to us a little bit about flu and the flu season. I know that the division has been doing a lot of
Great
flu
job.
clinics
good stuff.
around the city. I've seen they've been to some of the elementary schools, middle schools. Where else have you been?
Yes, thank you, Lisa, for inviting me. By the way, we already finished all the school clinics that we had. We have a total of 17 public schools and one private school that we went. And we had a good turnout. It's actually a higher percentage than last year. I apologize, I didn't get the exact figures. I'm still counting on it because we just literally finished for the whole month of October. We've been busy. We've been running around, and we have been going there with, of course, with the help of our PE nursing school here in Nashua. We also like to thank them for participating. The the Nashua Community College of Nursing and also St. Joseph School of Nursing. They're very, very helpful with us.
Awesome. You've also done some community flu clinics, right?
Yes.
Like where have you been?
Actually, I just literally came in. Sorry, that's why I'm late. I just came back just off the road, the Methodist Church. We get some invitation there, and I think we have like almost 20 people. We give flu shots, and at the same time, the hepatitis A vaccine that we're still promoting at this time because I think this is something that adults should be um, should be thinking of to get a vaccine because this is something that it's not only here in New Hampshire but also all over the world.
Yeah, I know that we're experiencing an outbreak right now, so we want to make sure that people get vaccinated so that we can address that and start seeing the numbers of people contracting Hep A to go down.
Yes.
So those numbers are out of
Yes. Right now we're focusing on the flu, but of course we have a sidekick there of the hepatitis A. We always bring hepatitis A for those who wanted it, and we're always going to continue promote the effectiveness of those vaccine preventable vaccination.
Are you also going outside of the city to do flu clinics? Are you doing libraries or anything
Yes.
like that?
We are part of Greater Nashua region, so actually, last few weeks we have done some outside Nashua. I hope this is. I'm trying to recall because I'm not the one who went there, but we are going to Milford, Wilton, and also we have some invitations at Hollis, Amherst. I mean, it's all over, and also Hudson. So we do go and spread spread how the information about our health department and of course vaccinate them.
We were talking earlier about the flu and how people can stay safe from the flu. Is there anything you can tell us besides, washing your hands
Yes,
and
definitely. Of
covering your
course,
cough?
the best preventable way is, of course, get the flu shot. If you haven't got it, of course, we already mentioned the washing hand. Get the flu shot because once you get the flu shot, if you get the shot, you need to wait first for around 2 weeks to make that activated in your system. You're going to be protected. So if you just have literally get the shot right now, you need to kind of wait for another few weeks or 2 weeks, and you're going to be covered. And that's the best way to prevent it.
And what other things can people do to stay prevent themselves from getting sick besides washing their hands?
Of course, eat healthy foods, exercise. What else? If they think that somebody get some symptoms of colds, then they need to. That's super. Like I mean, cover your mouth when you're coughing, and also um, eat healthy. I mean, if you have, you need to also routinely, if you are on multivitamins, of course, do that exercise. I mean, think of something that will make your body strong and healthy, and get a flu shot. I mean, I'm a public health nurse, so we always wanted everybody to get vaccinated. And flu shot is 40 to 60% effective, so you still need to work on getting yourself to have a good immune system. And sleep, have a good rest, and exercise.
Stay home if you're sick.
Oh,
Yes.
yes, I forget about that. Sorry, I seldom get sick. So,
Well, it's good to know you have a good immune system, Teresa. Um, Teresa, can you tell us a little bit about Teresa? Like, who's behind the mic? Who's Teresa? What does Teresa like to do? Do you have any hobbies? Um, Anything like that?
hmm. There's too much to say. I have a son, I'm a single mom, and I live in Nashua, and I love living here in the city. I think this is like, oh, you can go to anywhere in a short period of time. I love living here in Nashua. And I've been around in the public health for almost 10 years. March next year to be exact for 10 years. So um, it's getting there for the markdown of 10 years. Then I worked also with a long-term care facility for around 2.5 years, and also I worked in the hospital when I first came here from the Philippines in 2005. So, I mean, I pretty know about a little bit of the city and it's surrounded with healthcare, the organization, and for outdoors activity, I only have one son, but it's a lot of work. I'm still also doing some online class, keeping up with some educational stuff I need to complete by next year. So that keeps me busy aside from checking out those newly open restaurant. I'm a little bit of a foodie. I like to try a lot of different restaurant newly open in the malls. That is why I get all the vaccine that you can imagine. I'm always on top of the vaccine. So that's the one thing. That's one of the reasons that I don't really get sick um, because I get fully vaccinated.
Thank you.
So you're listening to the Public Health Hour. This is Lisa Vasquez, Substance Misuse Prevention Coordinator at the Division of Public Health and Community Services. And I'm here with April Torhan from our Environmental Health Department and Teresea Calope from our Community Health Department.
Good morning.
Yes. So, uh, we talked about foodborne illnesses. We talked about what the health department, what the environmental health does. What else does community health do besides immunizations and the immunization clinics that you're having? Like, what other kinds of services are available from community health?
Oh, yes. So we have three clinics scheduled in the health department, which is located at 18 Malvers Street. Immunization, I'm just promoting Tuesday, 4 to 7 p.m., and Friday, 8:30 to 10:30. And also, we have STD clinic, which if they have some sort of sexually transmitted diseases, then they can go there. So that is every Thursday from 3 to 6 p.m. It's there's no appointment for those clinics, so all they need to do is to show up, and confidentiality has always been kept, and we don't give information to kind of the facility or our healthcare provider unless they requested it. So that's a little bit good with clinic. A little bit like you will definitely have confidential information being kept.
And what other services are out of the
Health department. I think you already promote your services, Lisa.
No, yeah,
Okay,
no, we're just
this is
talking
Sana.
about the nurses.
Oh,
Yeah.
the nurses. Okay, so when we go out in the outreach van, we always have in collaboration with Susana, which is the middle exchange program, which Luis Forest is part of it, and we are in collaboration with them. So if we are outside the facility, we always get the needles. So if somebody called and answered the phone call, we can definitely deliver the services. Aside from that, we always have hold on, a lead program, which from age under 6 years old, if you go to the health department during clinic hours and you have a son that is under 6 and under, that you wanted to be checked for lead screening, definitely we can do that. And also the asthma program that is also sponsored by the state. We actually collaborate with the school system. So if they have uncontrolled asthma in the school system, definitely if they refer it to us, we're gonna follow them. We're gonna do some home visit a few times. We're gonna go there once a month at least, and we just need to monitor and making sure that they're using the proper medication and the tools for uh, getting the asthma control.
So do you teach them like techniques to control their asthma? Is it about checking like any environmental factors?
Yes.
Or
So when we go there, it's like a one-stop fits all. It's like we're like a little bit of checking what's going on with the environment. Of course, the referral is for asthma, but of course, if this is something that we need to give them a healthy change, like if we see that there's smokiness in the house, we definitely gonna need to, like, in a good way, that they're not gonna be offended. We're very, very nice people, so don't be scared. We're just trying to help out, spreading this, like it's always good, because of the asthma, of course, the trigger factor is smoking. So if they're smoking inside the house, they have kids, then that is something that we need to uh, give the parents some educational support. Support means like we can refer them if they wanted to think about ways to quit smoking, or if they're smoking, just go outside the house and at least that inside where their kids are there that has an asthma will not be triggered. And there's a lot of factors, like if you have an asthma and you have lots of like the scented perfume candles, then that's something that we need to check. And also those super highly perfumed spray that we use for cleaning, we can definitely discuss that. And there's a lot when you go there. Sometimes we need to discuss that, like vacuuming is important, and being tied up with, like if you have pets, definitely you need to vacuum all the time, because that's a dander, and that can trigger the asthma for the kid, and that is something that we need to prevent. So we're there to help, and trying to get them updated if they need some support. And that's why the health department is always there, and kind of like a support way. If they're ready, of course, we need to let them know that we are their support system, and they can call anytime. We have lots of nurses that can answer some questions that if there are some doubts, we encourage them to call the health department.
I have this image in my mind now of like all the nurses being like little detectives, trying to figure out what are the triggers for the participants of the asthma program, and being able to help figure out, what tools or skills or what things can be changed so that that child has, less triggers
Yes.
around and can manage their asthma. So that sounds like a really great program that is available. Can people self-refer, or do they need to be referred by someone else?
Okay, so initially when they open this program, the initial target is that the school system, the school nurses, is going to be referring it to us. So what we notice is they're pretty good with their job because there's very few who's referring, which is probably that's good because we are going to be there for those uncontrolled. So we kind of expand just to make sure that everybody's covered because if we don't get that much referral from the system, our targeted system, then we need to expand a little bit. So we open it to all the, not only for those targeted population, but a little bit expansion, even the high school and the providers itself. So when we're going to provider's office, we tell them, hey, if you have somebody, especially children, who do you think is going like uncontrolled? We like to go reach out to their home, and we hope that they're willing to accept us to just go home visit. That's the first step. And of course, we're not going to go show up right away without their consent. We have a form that the provider or whosoever we're going to be referring to us needs to let them know, and they are aware that we're going to be there. And we're going to call ahead of time, courtesy call. And you did ask the question, self-refer is also accepted. I mean, any referral will be beneficial as long as we can help out and just the to prevent more cases of this uncontrolled asthma.
And we have to like remember that uncontrolled asthma meaning that those kids are out of school
Yes.
longer, that they have more hospital visits. So it would help lower healthcare costs and reduce absenteeism in schools. So overall, the child will have more quality of being able to play and just feel better for a longer period of time. So that's a great program. I'm glad we are able to participate in it.
Yes, thank you.
Are there any other programs in out of community health?
I'm thinking, sorry. I just have a long walk there.
So what about if somebody finds out that they have salmonella?
Oh, you know what? Thank you, April, for reminding. So the health department, we have also a communicable disease program. And that is part of under the communicable disease program, which is there's some 50 plus diseases that needed to be reported. If you are a resident of Nashua, then the responsibility of the provider to report it, like what you said about the salmonella, then they can report it to us, and then we're gonna do some investigation there based on the referral, and we're gonna call the patient, and if there's a institution that is involved, we're gonna definitely tie it up with your environmental department, and we're gonna go collaborate with the organization affected, and that's how we solve the scenario.
Because I have had the nurses come over and say, oh, we have a case of somebody who doesn't live in Nashua but ate at some restaurant in
Oh, yes.
Nashua. And they've been diagnosed with, we'll say salmonella, for example. So usually we collaborate and, I'll go to the restaurants
Yes,
and
that's a
investigate
good.
on that end, and then the nurses are investigating with the patient.
Yeah, so the first thing that we check if we have a report for the actual client is where is the residency of the client. If it's a national resident, then we do investigate it right away. If it's not a national resident, we definitely can contact the state. If the state said, okay, this is just very near your place, and they're gonna assign it to us if it's national resident, then definitely we're gonna follow it up. If the place where they think that they got the source were in a restaurant located in Nashua, then that's the environmental thing, and we work together hand in hand. That's why this is really a fun job because we do a lot of collaboration activities. This is something fun, right, April?
That's right. I love when the nurses come over.
Yeah,
and talk to me.
definitely.
It's nice to see how all the departments kind of collaborate, even though they're different departments out of the division. Um, right now, we're gonna do the Spanish recap. So, buenos días, está escuchando a Lisa. Estamos aquí en la hora de salud pública. Hablamos sobre muchos temas esta mañana, como, especialmente cómo mantenerse seguro durante los días festivos. Hablamos sobre la comida, cómo prepararla, especialmente el pavo, que es tan popular en noviembre. Es importante que si compra el pavo y está totalmente congelado, que si lo compra una semana o más antes de que lo va a cocinar, tiene que mantenerse congelado. Pero si tiene que desfrizarlo o descongelarlo, al menos 2 días antes de empezar a cocinarlo. No puede estar congelado cuando lo va a cocinar, porque si no, no se va a cocinar bien. Es importante también eh, que toda la superficie donde está cocinando se mantenga limpia cuando está cocinando el pavo o pollo o cualquier tipo de carne. Es siempre importante limpiar esa superficie después que haya tenido contacto con la carne. Es importante que si queda comida después que ya todos hayan comido, que la mantenga en el refrigerador para que no se dañe. Si va a comer la comida que ya ha estado en la nevera, es importante también que la caliente al menos a 165 grados. Para que todo, si tiene algún clase de bacteria, esa bacteria sea eliminada. También hablamos sobre la influenza y la importancia que debe de tener para vacunarse, para mantenerse saludable, lavarse las manos, si está enfermo, mantenerse en casa. Hablamos sobre el departamento que chequea los restaurantes de la ciudad. Ellos nos mantienen a todos saludables, asegurándose que todo lo que trabajan cocinando la comida que comemos aquí en la ciudad esté hecha saludablemente para que nadie se enferme. Hablamos sobre los programas de salud pública, como que las clínicas de inmunización. Hablamos sobre el programa de asma, que es también de salud pública, que ayuda a los niños a mantenerse saludables como tienen un asma que no pueden controlar. Ellos hacen visitas a casa y hacen recomendaciones de cosas que se pueden cambiar en la casa para que los niños tengan menos ataques de asma. Puede ser como cosas como pasar el vacuum más seguido, si fuma dentro de la casa, fumar afuera, o si tiene muchos perfumes o limpiadores con fragancias muy fuertes, también tal vez cambiar de esas fragancias para que esos niños no tengan tantos problemas con el asma. Eso fue la mayoría de todo lo que hablamos. Y gracias por escuchar a la hora de salud pública. And that was our Spanish week. So, ladies, Are there any events coming up that you guys are a part of that you would like to let the community know about? I know I have, there, you are invited to a free wellness event, educational event. It's gonna be November 13th at 6 to 7:30 at Southern New Hampshire Health. They will have resource tables, they'll have dinner and a discussion and Q&A. And it's all about a chance to talk directly with health professionals. So we'll have Dr. Cynthia Whitaker there. She works out of the Greater National Mental Health Center. Jody Harper, who's a social worker at Lamprey Health, and Lori Goodman, who's insurance and community resources from Harvard Homes, and they'll talk to people about, how do you, what do you do if you need mental health services? How do you find out where you need to go? How do you navigate the mental health services and insurances to pay for those services? And what options exist for families that want to address their mental health needs? I know that it is a question that many people ask, like where should they go? Where should they call? Will their insurance company cover those visits? So it'll be a really great event for people who have any of those questions or who just want to know so they can, tell other people about those resources. So hopefully many of you will be able to attend. We're also going to have our Mayor's Opioid Task Force will meet on November 21st from 9:30 to 11. That's not Thanksgiving. 9:30 to 11, and we'll be kicking off our strategic plan. We've been working on that. We worked on that all throughout the summer. The document is finally all compiled. We'll be sharing our information on that day, and then we'll talk about next steps and how we're actually going to get all the work that we said we were going to do accomplished. So that is open to the public. Again, it's Thursday, November 21st from 9:30 to 11:30, and that's at the Natural Public Library. Do you have any upcoming events, Teresa?
Yes, thank you for asking. So on the second, actually tomorrow, from 10 to 12, we have a flu vaccination clinic at Brookline Public Library. And also on the 16th, I believe it's going to be in Amherst, and I apologize, I don't have my November schedule here in front of me. But if they go to the website of the city website, they should have some schedules there, like around the town and greater Nashua region.
Environmental health doesn't really have events that we put on, but we do inspect the food events that happen around town. So everybody knows the holiday stroll is coming up, and that's the Saturday after Thanksgiving. And a couple inspectors will be hitting the streets, inspecting all those mobile food vendors and the people selling food on the sidewalk, and all those guys are going to be checked out by us. And so that's a big event for our department. I will not be doing that this year, but the other two inspectors will be there.
Awesome. And I always wondered how do people know where to go, what to do if they want to have like a pop-up event out in the community, if they want to have like a barbecue or anything like that, like who do they need to contact? How long before the event do they need to contact them? Like what are the steps for people? Because I don't think everyone knows that you should contact, environmental health if you're planning an event that the public will have access to.
Right. So, and that's a great question because we do have a lot of events that just happen, and we show up and say, "Where's your food license?" And so that can be a difficult situation for everyone. So, if you want to have an event where you are serving food to the public, like an event open to the public, you would need to contact the environmental health department at least 2 weeks in advance. And so we do say like no food prepared at home. So the food needs to either come from a licensed restaurant, or in some situations you're preparing food there. So if it's like a barbecue, you're going to be barbecuing it right there. But if you're serving subs or something, you probably wouldn't be assembling the subs outside, but you would get them from a restaurant or a grocery store or something like that, but nothing from your house. But so you would need to let us know 2 weeks in advance.
And what's the number that they should call?
The direct line over there is 603-589-4530, and that will get you to the Environmental Health Department. And you can tell whoever answers the phone there that you want to have an event and you want to serve food and you need to know what to do, and you'll be directed to one of us who can help you with that process.
Doesn't sound like very difficult or stressful.
No, it's usually very simple. We have an application, we can email it to you, and you can fill it out and return it to us. Sometimes it gets a little bit more complicated if you want to do it really park. So there's rules from the parks and rec people about what can happen in the park versus the sidewalk versus the street. So those things can get a little bit more complicated. But as far as the food is concerned, we have a pretty easy application and we can help people fill it out if they're confused.
And it also seems like you can give them information on like the venue that they're, so if they do want to have it at Greeley Park, for example, you would know who to contact there and you can let them know what to do. So
Yeah.
I feel like it would be easier if they call,
Right.
even to navigate any other.
It's easier for us to help kind of guide you through the process a little bit if you're completely unsure as to what you need to do, who you need to talk to, and what forms you need to fill out. We can certainly help you with a good chunk of that stuff.
So it's Friday, it's almost the weekend. I'm wondering what you guys have planned. My Saturdays usually involved being a soccer mom in the morning, getting up early, getting my kiddo ready to go play soccer, and then just watching him run around. Usually playing tag with the other kids instead of playing soccer, but still he has fun and he gets the energy out, so that's all that matters. But do you guys have any plans for the weekend? That's mostly it. And of course, trick or treating is going to be tomorrow.
Trick or treating here in Nashua Saturday.
From 6 to 8, I think.
Yes, you are
Is the
correct.
time. So just be aware that kids are going to be out tomorrow night. If you are taking your kiddos out, they should have some sort of reflectors. It is getting darker earlier now, so by 6 o'clock it's going to be dark. So make sure that you have flashlights or some reflectors. And if you're driving out, please drive carefully. Use your headlights, which you should have on anyway. But especially if you're in the residential areas, make sure you're driving a little slower, just because it's Halloween and we don't want any incidents to happen.
Yeah.
And if you haven't had time to go, shopping for candy, I think it might be on sale now because Halloween is over. So maybe it is a good time to have trick or treating after the holidays. So, what are you guys planning for the weekend?
Yeah, I live in Nashua, definitely, and I have a 7-year-old son, so the trick or treating is going to be something that I'm going to be participating in. And I noticed tomorrow it's going to be chilly. It's 51.
Okay, well, listen, this is the 31st day. I don't want another
So
gun.
make sure tomorrow there should be
Bundle them out.
covers there. Bundle them out.
Yes. What is your kiddo gonna be?
I believe he picked up Fortnite, and that is good because it's got a green, like light green, so that will make up the reflector there.
My little kiddo is gonna be Duke Kaboom. It's from Toy Story 4. No one knows who he is most of the time. He's not familiar. He loves the movie, so he's pretty excited. And April, do you have any plans for the weekend?
Oh, I'm planning to make a nice run this weekend and then change my clocks.
Oh yes, remember,
Yeah.
change your clocks. Sunday is
Sunday morning.
Sunday morning is the time. So we'll get an extra hour in the morning. It's my favorite time. I can sleep a little extra. Hopefully my kiddo gets the memo, my 1-year-old, and he will also sleep an extra hour, or else he'll be for her friends. So this has been the Public Health Hour. Thank you so much for tuning in and listening. Our guest today were April Torhan from our Environmental Health Department, Louis Porras, our outreach worker, Teresea Calope, one of our nurses from Public Health, and your host today was me, Lisa Vasquez. So thank you so much for tuning in, and have a happy, healthy weekend too. Take care.
Thank you.
Thank you. Thank you. This was Lisa. And that's Lisa. I'm sorry. Thank you very much.
Oh, you have a 1-year-old already?